Alrighty.
Awesome. All right, thanks for your patience, everyone. Some technical difficulty, of course. Let me turn off the volume of my laptop. So hope you all are doing well. My name is Rachel. I work at the Medicare Rights Center. I don't know, actually, I'm gonna take off my mask while I talk since I think we're sufficiently far apart. I work at the Medicare Rights Center. We are a nonprofit consumer service organization, and today, thanks to the Isaac Center and Councilmember Menin's office, to talk to you all about Medicare cost assistance programs. So just a little bit about us before we get started. Like I said, we're a nonprofit consumer service organization. So we have, the main thing that we do is we run a helpline where we answer questions about Medicare, for New Yorkers and actually nationwide. We also do educational programs like this one today. We go to different community centers and different health events and, provide information on Medicare. And then we also do policy initiatives. The lovely thing about, the way our organization works is we can really take what we hear from beneficiaries directly on our helpline and really add that to our advocacy. So we're actually coming from a place where we're, hearing firsthand what are people's experiences with the Medicare health care system. So today I'm going to be talking about 4 programs. The Medicare Savings Program, or sometimes known as the MSP, a program called Extra Help, another program called EPIC, which stands for the Elderly Pharmaceutical Insurance Assistance Program, which only took me 5 years to remember that acronym. And I'll be talking a little bit about Medicaid as well. And so here's a summary of the 4 programs. Oh, wait. How come it's not advancing on no. Okay. Oh, no. I'm like, I can see the next slide here, but not there.
Try one more time going back and then forward. No.
That's something like connected. I may just send you the presentation and then maybe
Let's do that.
Okay.
Let me go get my other one.
Sorry about that, folks. We try to prepare. I will, I promise. But it stands for Elderly Pharmaceutical Assistance Program. Yeah, I just sent it. Proof that we don't need to be online. On it. So while we wait for that to load, it might be fun to do a quick kind of survey of the room. How many of you think that you are in a Medicare Advantage plan, like you have an HMO or PPO? Raise your hand. Okay, we got a couple folks. How many of you have a supplement or a Medigap? So like your card might say Plan N or Plan F or Plan G. Okay, we got 1, 2, 3. Okay. And how many of you know when the Medicare open enrollment season is? Who could tell me? We can play school a little bit. Should I call on someone who wants to answer? Anybody? You in the front?
I believe it ends on December the 5th or 6th, but it's like the last week in November up until that's what I think.
Close. That's the marketplace open enrollment. Medicare open enrollment starts October 15th and it ends December 7th. So we have some time. But just seeing like what the knowledge is here. What else could we? Did you get the email? Awesome. How many of you pay way too much for your prescription drugs?
What is that?
How many of you pay too much money for your prescription drugs? I know I do. No? Yeah, no, it depends. So that's very true. No, that's okay. I'm just trying to entertain. All right, I think. Okay, can you take us to the fourth slide, please, where we left off? Okay, hopefully no more problems. All right, so as you can see, this is kind of a quick summary of the four programs that we're going to talk about today. So the first is the Medicare Savings Program. Oh, I'm so sorry. The first is the Medicare Savings Program, and what it mainly does is it pays for the Medicare Part B premium. So if you get Social Security or Social Security disability, that Part B premium might be deducted from your check. If you're not collecting yet, like you're kind of postponing collecting, or you don't qualify for any Social Security benefits, you may get a direct bill for your Part B premium. But what this program does is the state Medicaid program actually pays for your Part B premium. So it can save people a lot of money. And then in some cases, if people have a premium for Part A, which you might, if you don't qualify for retirement, there's a Medicare Savings Program that can pay for Part A as well. And then extra help is specifically for prescription drugs. So again, it helps pay for the Part D premium, or the month premium is the monthly cost of your prescription drug coverage. And then it also covers, there's no deductible, and the co-pays are much lower when you have extra help. EPIC is a similar program, but it's specific to New York State. It's only for people over 65, but the income limits are much higher than extra help, and there's no asset requirement. And it can also help pay for prescription drug costs. And then the last that I believe a lot of people have heard about is Medicaid. So Medicare and Medicaid can work together, so you can have both, but Medicare is the primary insurance, and Medicaid kind of pays for a lot of the leftover costs. So whether that's like co-pays or co-insurances, or it might pay for services that are excluded from Medicare coverage. Next slide, please. Are you? Yeah, here it is. MSPs or Medicare savings programs first.
It changes a little slower than us. But it changes.
All right, we got it. So again, the standard monthly premium for Part B is $164.90. Sometimes people who have higher incomes might have premiums that are higher than that, but for most people it's $164.90. And if you are eligible for the Medicare Savings Program, basically you apply, and then if you're approved, the state just automatically pays that premium for you. So you get, if it's deducted from your Social Security check, you get your entire check without the deduction, or if you are directly paying, you just no longer receive a bill. And if someone has, yes, question in the back.
I received social security, but they take out $168.
168.
Yeah.
I'm not sure why the extra $4. It could be if you have a drug plan, sometimes they ask you if you want to have them also take out your drug plan premium from your check. So if you said yes, then they could also be deducting that. You'd have to look at your Social Security award letter. It should list all your deductions on it. Yeah, no problem. So if you're eligible for the Medicare Savings Program, another thing that it does, which hopefully none of you have to worry about, but if you enroll late into Medicare, then it will eliminate any late enrollment penalty that you would have. And it helps people enroll in Part B if they're not already enrolled. And it also automatically gives you the extra help program. So that program that I mentioned that helps with prescription drugs, once you have the MSP, you automatically get extra help. So you don't have to apply for each one separately. Next slide, please. So really exciting this year. So for a long time, the Medicare Savings Program had really low income limits. And what this meant is when people became eligible for Medicare, who maybe like previously had Medicaid or previously were paying much, lower costs for their health insurance, all of a sudden they would become Medicare eligible and everything, all their costs would go up and they weren't eligible for a lot of programs. And so we, along with a bunch of other advocates in the state, advocated to expand the program and allow more people to be eligible. So in January, they had the new expanded limits. The new expanded limits have gone into effect. And so, previously, you would have to, the income limits were around like, well, now I'm like forgetting the figures, but you'll see we'll put up the new figures and they're a lot higher than they used to be.
Like 900 something, right? It would be.
For Medicaid, it was like 900 and something. Yeah. So it's gone up to 1697 for Medicaid. So yeah, so it's a pretty big jump, which is exciting because, I mean, you all, I'm sure, live in New York City, how expensive things can be. If someone is just living off of Social Security and they have medical bills and utility bills and all other things going on, like, it's like, how is anyone supposed to afford rent and basic needs? So we're really excited that they decided to kind of do the right thing by New Yorkers and expand these really essential programs. So you can next slide, please. So basically, there's two different types of Medicare savings programs. One is called Qualified Individual, or QI. And then there's Qualified Medicare Beneficiary. And the difference between these two programs are Qualified Individual offers 3 months retroactive benefits. So meaning when you apply for the Medicare Savings Program and you're approved for QI, you can get reimbursed up to 3 months retroactively on Part B premiums in the same calendar year. Whereas Qualified Medicare Beneficiary is a very generous program because it not only pays for the Part B premium, but it also gives you something called balance billing protections. So what is balance billing protections? We'll talk a little bit about it, but it basically means that Medicare providers are not allowed to charge you deductibles, co-pays, or co-insurances. And you don't get to choose which MSP you get. It's the local Department of Social Services, or here in New York City, it's HRA that decides which one you're eligible for. Yep. So these are the limits up here on the screen. As you can see, they measure the monthly income in terms of household size. They basically married, or you're a couple, or legally married. So sometimes we get that question of like, well, what if I'm legally married and but I'm not living with a spouse, I'm like maybe getting divorced, or there's a complicated relationship. The answer is, if you're not living together in one household and you're then you're considered a single individual for the purposes of this program. So the income limit for a single person is $2,280. For a couple, it's $3,077. And for QMB and for Medicaid, the income limit is $1,697 a month. And for a couple, it's $2,288. So these, we'll talk a little bit more about these income limits, but there's different ways that this income is calculated. So definitely, if you're not sure whether you qualify or not, it's always a good idea to reach out to our office or reach out to other organizations who are knowledgeable to make sure that you meet the criteria. Next slide, please. So, like I mentioned, QMB is kind of a unique program because it pays for Part A premiums if you don't qualify for Social Security retirement. So as some of you may know, if most people have Part A free, they don't pay a premium. But for those people who just don't have a lot of work history in the US, maybe they immigrated, or maybe they just didn't have a very traditional career path, they might have a Part A premium. So the QMB benefit can pay for the Part A premium and enroll you into Part A. There's something in New York State called the Part A buy-in, which I won't talk about too much unless people really have questions about it. And then the other thing that it helps with is, like I said, billing. So if you are eligible for QMB, there is a federal law that says that Medicare providers are not allowed to bill you for deductibles, co-insurances, and co-payments. So meaning if you go to a doctor who accepts both Medicare and Medicaid, they can bill all of your co-pays and co-insurances to Medicaid. If they don't accept Medicaid, then they're not supposed to bill you for co-pays or co-insurances or deductibles. Next slide, please. And we definitely get problems from providers who bill people anyway. We can definitely talk about that if folks are interested too. So here's a little information about the Part A buy-in. So again, I'm not sure how many people this would apply to, but if you are 65 years old or older, you are a US resident and either a citizen or lawfully present, which usually means like you have a green card and you've been in the, US, but you are not eligible for premium-free Part A, and you are eligible for QMB, you can use this, this process to basically get up to Part A. And then this is more information about the federal law around improper billing for QMB beneficiaries. So, yeah, and basically, when people are improperly billed, what we typically tell them to do is to file a complaint with 1-800-Medicare. However, some people are not super comfortable doing that because they want to maintain a good relationship with their provider. So our office can definitely be helpful in that sense. We can, try to informally advocate with the provider and tell them how they can, verify someone's QMB, how they can possibly bill, what are some, try to work out something else to avoid having the bill sent to collections, because that is nobody ever wants that. Next slide, please. So typically, some of you I think raised your hand when I asked if you had a Medigap or a Medicare supplemental plan. So technically, when someone has QMB or Medicaid, Medigap insurers or private companies are not supposed to sell you a Medigap if you already have QMB, because it's basically, QMB helps with all the co-pays, co-insurances, and deductibles, and Medigaps do a similar thing. So it's kind of, it's considered what they call duplicative. But if you have a Medigap prior to getting QMB, you can of course keep it if you want to. And there's some reasons why people choose to keep it, or might choose not to. And then recertification. So typically everybody who is on the Medicare Savings Program or Medicaid has to recertify every year. During the public health emergency, there was basically these provisions from the federal government that required states to make sure that people kept their Medicaid and Medicare savings program benefits. So the state of New York was basically like, no recertification for 3 years. It was a glorious time. No one had to complete paperwork to keep their benefits. But unfortunately, that is ending. And so people will have to recertify their benefits on an annual basis. You know, it's not the worst thing, but it's basically like just, again, more paperwork to sign and complete and more documents, which is, you know, sometimes annoying. So we get a lot of questions of like, am I over the income limit? If I'm a little bit over, should I apply? So our answer is always try to apply, or at least kind of look into it, because there's some income that can be, some bills or premiums that can be discounted when they're calculating your income. You know, sometimes income can be counted differently. So if you have Social Security versus, you know, another type of benefit, or you're working. So it's always good to kind of see like how your income is actually counted before you kind of say, oh, I'm not going to apply. Next slide, please. So how do you get the MSP? So in New York City, you can apply directly through the Human Resources Administration. We also help people apply pretty much every week. We have new people calling us asking for assistance, and we're happy to help. It's a fairly simple application, but sometimes people just, you know, feel better knowing that like we have a direct fax number that we can send the applications to. So if you do want our office's assistance, you can, you know, call our helpline, which is listed on the screen. It's 1-800-333-4114. And you can literally just say, I'm calling about the MSP, and they can, you know, help you from there. We typically have, you know, trained staff who will contact you and basically gather all your information, put it into the application, submit it, and then, you know, you get a decision within like 30 to 45 days. And we submit applications in batches every month. So now I'm going to talk about extra help, though before I begin, does anybody have questions? Anything I need to clarify? It's a lot of information and I'm trying not to go too slow. Yes.
So I don't have Medicare yet,
Okay.
so I'll dip here gathering information. So do I apply for this MSP at the time when I apply for Medicare?
Yeah, so in order to, so I guess it kind of depends on your situation. So if you are collecting retirement, you should automatically be enrolled into Medicare. If you are still working or you're not collecting Social Security retirement, then you would apply you would do an application for Part A and Part B through the Social Security Administration. And then, you know, if you were worried about, you know, the cost of the premiums and you think you might be eligible, then you could go ahead and do the Medicare Savings Program application, or we could help you with it.
Right, so that my next question, can we call you guys up? So.
Yeah, no, of course, we can definitely talk more about your like individual situations, because everybody's, you know, situation is different. So like, you know, especially if you're, you know, if you think that you might not qualify for premium free Part A and need some counseling on that. So like, yes,
So
we're happy to talk with people one-on-one too. That's our helpline number. So the 1-800-333-4114, and we're open Monday through Friday during you know, the kind of regular business hours.
If you don't already have a social worker, or if you do, you can meet with the social workers to help you complete the application. This isn't to steal any work for you, but
You guys are deputized with us, right? Or not?
Sure, I don't think so, but we have case assistance services with social workers here. So if you find that the application is too overwhelming to complete on your own, or you have some questions about it, the social work team can try to help you as best as they can. And then if not, you can also reach out to the Medicare Rights Center.
Yeah, so
Thank you.
honestly, no worries, because there's so many people that need, you know, that we're helping applying. So it's, you know, we're not short of people needing assistance. So
Yeah, especially with the expansion of the Medicaid eligibility. I think that a lot of the offices that deal with insurance are going to be overwhelmed with people in cases. So if you need assistance, definitely reach out to us. We'll help you as much as we can.
but yeah, not to say that we're not available as well, but I think it's okay to reach out to your social worker if you have one here through the Isaac Center. So I'll talk about Extra Help. So Extra Help is a federal program. So the MSP, the Medicare Savings Program, is state by state. So the income limits, the rules is only in New York State. So if you have friends in other states and you send them the stuff on the Medicare Savings Program, it's not going to apply to them. So don't send it to your friends in New Jersey or Connecticut or another state because it's not going to apply. But this is a federal program, so it's the same no matter what state you're in terms of, you know, the rules. So it's a federal program. As I mentioned, it pays for the prescription drug premium. It also pays for co-payments, co-insurances, and deductibles. And it only works if you have a Part D prescription drug plan or you have a Medicare Advantage plan with Part D benefits. Next slide, please. So these are the limits for Extra Help. As you can see, for this program, there are income and asset limits. For a single person, the income limit is $1,843 a month. For a couple, it's $2,485. And the asset limit for a single person is $16,660. Sorry, I'm looking at the screen because I still haven't memorized these yet. Since it's, you know, they just kind of came out with some of these numbers. And then the asset limit for a couple is $33,240. And unlike the Medicare Savings Program, in terms of the household size, if you are a single person, but you're financially supporting a dependent, the Extra Help program does take that into account. So I've had a couple of cases where I've worked with someone who maybe was like a grandparent who is taking care of a grandchild and providing financial support. So even though her income was technically over the limit at the time, because she was giving that financial support, she was able to qualify for Extra Help, and it was like a huge deal for her. So also feel free to ask us about that program. If you're not, you know, interested in the Medicare Savings Program, but you may have some drugs that are expensive, you know, we can definitely talk about Extra Help with you. So how do you get Extra Help? So Extra Help, you can be automatically enrolled. As I mentioned, if you qualify for the Medicare Savings Program, you automatically get Extra Help. Or you can actively apply. So Social Security has an online application. You can call them and apply, but between you and me, being on hold with the 1-800 number is not the most pleasant. You can also go in person, or we can help you with an online application if you give our helpline a call. And so then the other types of assistance for prescription drugs. So there is the EPIC program. So it's technically EPIC is something called a state pharmaceutical assistance program. So other states have similar programs, but EPIC is unique to New York State. There are also manufacturer discounts or patient assistance programs that you can find on Needy Meds or RX Assist. Sometimes there are charity programs, and you know, if you need a medication right away and there's an affordability issue, sometimes your provider might give you samples, or there's like it's like Apple New York. There's like a New York State assistance too that's not through Medicare that I'm forgetting now off the top. It's like Apple New York or something like that.
It's on the tip of my tongue, but I forgot.
All right, next slide, please. So we'll talk about EPIC. So EPIC again stands for Elderly Pharmaceutical Assistance Program. It's similar to Extra Help because it covers that that Part D premium, and it also allows people to have something called a special enrollment period, or SEP, which basically means that you have more opportunities to switch your drug coverage if you're not happy with your plan. Besides that kind of fall open enrollment that we were chatting about before.
The Big Apple RX.
Yes, got it. So in order to be eligible for EPIC, you have to be 65 or older, and your annual income has to be below 75,000 annually if you're single, or 100,000 if you're married. So, you know, a lot of people think, oh, I'm not eligible for any of these assistance programs. don't even bother talking to me about them, which is like understandable, but I'm like, I always ask them like, can I at least talk to you about Epic? Because so many people that think they're not eligible for programs sometimes are eligible for Epic. You can't have Epic and Medicaid though. So if you have Medicaid, you'll have extra help. So you don't really need Epic anyway, but you can have both. And it also can help you enroll in a Part D plan if you didn't enroll when you were initially eligible to do so. So it can be really helpful. Applications can be accessed online. You can also call the Epic helpline. I've done a few applications over the phone with Epic, and their representatives are actually really great. They're probably like the best representatives I've worked with on a helpline before, besides I guess our helpline. But they're usually very efficient, very nice, and you can even have them do an expedited application if you need to pick up prescriptions at the pharmacy and you're having trouble affording them. You can give them the name of your pharmacy and they can call the pharmacist and basically help the pharmacist bill through Epic to make the cost of the drugs lower. So can't say enough good things about Epic. And now I'll talk about Medicaid a little bit. So Medicaid is technically a state and federal program that offers health insurance. So what do I mean by that? Well, mainly about funding and money. So the federal government gives states, some funding towards Medicaid, and then states also kind of have also fund the Medicaid program. And typically people, when you have Medicare or you're over 65, there's a type of Medicaid that you can qualify for. It's called age blind and disabled Medicaid, very old term. And sometimes people just refer to it as the traditional Medicaid. And the Medicaid program that was expanded or, through the ACA is kind of known as expanded Medicaid. So they're two different Medicaids. And then as I mentioned, when you have both Medicare and Medicaid, you basically have two insurances, but your Medicare is what we call the primary insurance. So it pays first, and it usually pays the majority of your medical expenses. And then whatever you have left over, like if you normally would have copay or co-insurance, Medicaid can pick up the rest of that cost. It can also help with other things that aren't covered by Medicare. So unfortunately, Medicare doesn't cover like routine transportation. So like if you just want to ride like to and from a doctor's appointment, but it's not like an emergency, you don't need an ambulance, Medicare doesn't cover that, but Medicaid does. So for things like that, the other major one is like routine dental care, routine vision, which hopefully in my lifetime, Medicare will cover that, but for now, it's not a covered service. So most people who are on Medicare either get those services through a Medicare Advantage plan or they get them through Medicaid. And here are the income limits and asset limits for Medicaid. So as you can see, previously the income limit for a single person was like $905. And now the income limit is $1,697. So this expansion for Medicaid and the Medicare Savings Program is a really big deal. And I think will make a really positive difference. So the asset limit for individuals is $30,182. And then for a couple, it's $2,288, which is the same as QMB. And the asset limit is $40,821. Next slide, please. So there is something called a spend down. Basically, if someone really needs Medicaid coverage and their income is over the limit, they can do something called a spend down. It's essentially like paying a premium, but you pay it to Medicaid, and that amount is the difference between what your income is and what the Medicaid income limit is. So everybody has a different spend down. You can also use medical bills to meet your spend down. So a lot of times we'll hear from people who maybe had a major hospitalization, like they went to the hospital, they have thousands of dollars in debt, even though they had Medicare coverage. And they also need other services that Medicare doesn't cover. Sometimes, we can help them use their medical bills to meet that Medicaid spend down so they don't have to pay, all of those bills. And that allows them to have active Medicaid coverage as well. So again, hopefully none of you need to actually know this, but it may be helpful if you do end up needing Medicaid in the future to know that there is a way, even if your income is above, to access Medicaid benefits.
Just a reminder that a lot of private insurances unfortunately do not cover home care,
Yes.
but Medicaid does. So it's a
Yes.
really,
Exactly.
yeah.
Exactly.
So it's, yeah, so it's a really big deal that they were able to adjust the Medicaid eligibility criteria. Because a lot of people who formerly struggled with getting assistance, getting approval for hours for home care. Can now apply for Medicaid and see if they're approved for home care.
That is, I'm so glad you mentioned that, because I was gonna mention it a little later, but yes, that is true. That one of the major services that Medicare doesn't cover is what we call long-term care. So whether that's in a nursing home or whether that's in the community, if you want someone to help, or if someone needs help with, you know, having a shower, getting dressed, or you know, cleaning their house or food shopping, some of the like basic day-to-day needs. Medicare doesn't cover those services unless you kind of have other what they call skilled needs, or you need kind of intensive physical therapy or occupational therapy. And the amount of hours that Medicare covers is really negligible. So a lot of New Yorkers, and I think people around the United States rely on Medicaid to provide that essential, you know, in-home care. So yeah, so more people qualifying for Medicaid means more people can access those services as well. And oh yeah, I already talked about medical bills. And here's an example. I think we can skip it because we started late. I'm always happy to stay after though if people want to talk more about the spend down. So next slide, please. Oh, it's just isn't taking its. So you can contact the local Medicaid office to apply, or contact this New York State Department of Health's Medicaid hotline. The other place that we direct people to is something called a facilitated enroller. So I don't know if the social workers here, if there's a facilitated enroller program, but we work with a few places, Public Health Solutions. So if you need kind of a referral, we're happy to give you one to our partners who do Medicaid applications, because that's not necessarily our forte. And resources. So here again is our helpline number. It's the 1-800-333-4114. And we have a website. So if anybody is on the web and you want to, you know, see a lot more information about these topics, you can go to Medicare Interactive. And it's free, public, open to everybody. What?
Went away too quickly.
I know.
Oh, sorry.
We're trying to write this down.
It's MedicareInteractive.org.
Yes, it's www.medicareinteractive.org. And our education team does a fantastic job of updating those resources and making them consumer friendly. But if you ever have feedback, you're welcome to let us know. And you had a question in the back.
Do you have printed information to get out with some of
If you're okay with me, I can copies of the slide.
Yeah, or I can actually send you, we have a flyer too. So we can we don't have them right now, but we can get you printed materials.
This is also being recorded, so I'm gonna email the link on YouTube out either tomorrow or tonight.
So I want to talk very briefly about two programs that we are a part of. And I actually work on both. So the first is something called ICANN. It stands for the Independent Consumer Advocacy Network. So ICANN is really for New Yorkers who have, you know, Medicare and Medicaid who need long-term care. So when we were talking about home care, that's really like who we're talking about. So these are people who already qualify for Medicaid. They've gotten the home care. They might need help, you know, picking a plan, navigating their insurance options, or sometimes they might need help accessing services or more services. So ICANN is basically a consumer advocacy program. that helps people with those needs. And we serve as like the Medicare specialist. So whenever there's a Medicare question, we are on the case. And I also do casework. We also do casework. So this is the ICANN helpline number, and there's an email and a website separately for ICANN. So if you or someone you know needs home care in the state of New York and wants more information, you can definitely call or go online and check out more information from ICANN. And that helpline number is 844-614-8800.
I'm gonna have it printed out and I'm gonna email it, so.
Okay. So the other program we're a part of is called CHAMP, the Community Health Access, Addiction, and Mental Health Care Project. So this project is specifically for people in New York who need access to mental health care or addiction treatment. So this is not just for people with Medicare or Medicaid. This is like for anybody. So if you know anyone who may be uninsured or they have, commercial insurance or employer insurance, and they're having, trouble accessing mental health or substance use disorder services, they can contact CHAMP. We are, again, the Medicare specialist for CHAMP. So we help people who are on Medicare if they're having trouble, finding a mental health provider, or they need inpatient treatment. We help people navigate those kinds of issues, or they have medication that they take for the mental health and they can't afford it. All kinds of things that can come up. So the helpline for them is 888-614-5400. So you can direct people who don't have Medicare to call their helpline, but if you do have Medicare and it's a mental health related question, you can still call the Medicare Right Center. You don't have to call CHAMP. This is going to come back to us anyway. All right, well, thank you all so much. I really appreciate your patience with all of the tech issues. I'm happy to just kind of stick around if you want to chat. And we'll also, I think, try to print out some flyers if you want to take those with you. But I'm also happy to, if you want to call back, and you can just put your, you can either send your information to Gemma, or you can, if you're on the sign-in sheet, you can just kind of make a star next to your name if you'd like a call back from our office. Thank you. Thank you all. I really appreciate your patience. Thanks.
Hi, and I have one.
Yes, I think, are we done with the recording?
Yeah, I'm just gonna leave it on, so if anyone over here has any questions and they apply to them, they can there.
Yeah, sure. Awesome.
I find it really difficult to communicate. When I call and I leave a message, and they call back. But I should. So we need to tell them, and this one, go. So it becomes like a going around.
Unfortunately, that's the difficulty with these agencies. A lot of them are still getting restaffed up post-COVID. Yeah, I mean, they were already inundated with cases, but now expansion and full.
Did you put your name on the sign-up list?
It's a little bit harder, but you can always come and get a Joanne with basic information and application and stuff. Write it down with the social work team here, and then anything more specific, you can reach out to the Medicare.
Yeah. Can I get your name?
I'm happy calling those two agencies. Number and it seems to be like they can go around for whatever.
Yeah.
Did anyone else have any questions, non-case specific? Yeah, do you get my daily emails?
I don't.
Okay.
All right, thank you everyone who joined online. I'm gonna close this out.